Hi, Kinesiology 4120. Today we're going to talk about training different populations, special populations. We'll talk about training youth. We're also going to talk about older adults, safety concerns, things to think about when we're looking at different age groups, both chronological age and biological age, and how we can manipulate our training programs in order to best suit the individuals we are working with, whether it be youth athletes, adolescent athletes, older adults, um, just regular adults. Um, we'll also talk about how to coach different groups, how to really work with those groups to get the best out of their training program. All right, so let's get started. So when we talk about different age, we have our growth cycle. We have pre-adolescence, which we call youth. The pre-adolescence would be anywhere before puberty. So this is often junior high and below. You can train this group. There is training for this group. Often it's more outdoor. It's more running, movement, general movement with this group. As they move into adolescence or puberty, this ranges anywhere from, in some cases, 9 or 10 years old, all the way up to, in other cases, 20 to 25-year-old. It's anywhere from pubescence all the way up to adulthood. So you'll see somewhere either adolescence would mostly be termed as kind of junior high and high school, sometimes going all the way up through the collegiate age bracket, because full development doesn't happen until about the age of 25. And then we look at adulthood. This is full physical maturation. This happens later in men compared to women. Same with adolescence and puberty, happens later in men compared to women. But this is when we can optimize really that athletic performance. Youth or pre-adolescence and adolescence are both times for development. Adulthood is really for that competition period in an individual's life. And that physical maturation lasts up until older adulthood, which would be ages 65 and up, which is a pretty large age bracket from about 25 to 65. You'll see very high level competition often between the ages about 20, 25 up to about 30, 35, maybe 40 for elite competition. In some sports that can go longer depending on the physical demands of the sport. But looking at kind of young adult compared to middle-aged adult compared to older adult, we do have to take into consideration their development, their activity level, and their physical competence, how long they've been training, if they've been training, if they've been sedentary, and so on. Okay, so let's start with youth and adolescence. We're talking pre-puberty here. We need to really consider their chronological age compared to their biological age. Chronological age is how long they've been alive. So this is kind of their actual age that you would see on from their birth certificate up until now. We're talking about how old they are. Biological age is their development. So if they've developed further, if we're looking at when puberty occurs, you'll see often in kind of that junior high to early high school age where you'll see a lot of changes. You'll have two individuals. One will be 14 years old, 6'2", a beard. The other is 5 feet tall and looks like they could still be in elementary school. That's their biological age, their developmental stage within their life. And then there's their training age. This one we also need to take into consideration. This is how long the individual has been moving and moving in those patterns that we're kind of looking for when it comes to physical preparation, training, how long they've been running, sprinting, all the way up to lifting weights, training with body weight exercises, really training in general. This will really tell us their movement competency when we're working with them as strength and conditioning professionals. So some individuals may be 18 years old but have a training age of 1 year. Maybe they barely have 1 year at all. You may work with individuals at the college level who have never picked up a barbell, never touched a dumbbell, never done any kind of specific training. All they've done is their sport. They have a very low training age and you have to train them as such. You can't expect just because someone is a very good athlete for them to also be very good at training. You'll have others who have been training since they were 12 and now they're 25, and then they have 13 years of experience and they are very proficient in the basic movement patterns, and you can really use some of those fancy, tricky methods to really elicit better performance. Okay. We also do need to look at sex differences, looking at males versus females. Females will develop sooner than males, so often think about that adolescent age. That adolescent clock starts a little bit earlier in females, but we do also have to look at differences when it comes to what happens during that period. Up until about puberty, up until adolescence, there's not too much difference between males and females when it comes to training physical capabilities. But once puberty hits, once that development starts to go, once those hormones start to take hold, we see a drastic difference in the amount of muscle mass, in strength, in growth, in males compared to females. But often if you are developing sooner, if females have a longer training age, they can express strength just as well as males. But you're going to see more muscle mass, more hypertrophy. You're not going to see very much hypertrophy within your female athletes. It's going to be very difficult to do that. It's much easier in male athletes, especially during adolescence when they have a surge of testosterone. We talked earlier in our endocrine section about how testosterone really fuels that growth, that hypertrophy. Those levels are much higher in adolescent boys compared to adolescent females, or adolescent males compared to adolescent females. So we do need to take this into account. So there are some also coaching implications. Female athletes are often a little bit better to coach, a little bit easier to coach. They often don't have the ego of young males who think that they know everything and can rule the world. And you need to take that into account. You'll often see more technicians, more really perfectionists on the female side. You'll see more lack of care and lack of attention to detail in training with male athletes, especially if they have a younger training age. Okay. If we look at how this can benefit these people, these individuals, these youth or adolescent trainees, they have many benefits. Okay. For one, it's safety. Learning how to move and learning how to move correctly will develop athleticism long term. It doesn't mean that a 12-year-old female who is just going through puberty is going to be lifting thousands of pounds. But learning how to move well, especially with body weight and with external load, external resistance, different movements are going to benefit safety. It's going to lead to long-term health. Individuals who learn how to move correctly when they're younger or have more movement competency at a younger age are more likely to be physically active long-term because they feel that they can be physically active, that they know what they're doing. And when it looks into bone health, we know that bone health or bone mineral density increases through adolescence and tops out around the early 20s. So especially within male and female athletes who are building their bodies or developing their athleticism, they're also developing their bone health, especially in these female athletes. If we can develop bone health earlier, we know that bone mineral resorption is slow in that time period, especially if you have a lower starting bone mineral density, you have a higher propensity to lose more and be more at risk for osteopenia, osteoporosis, younger in age. Okay, so think middle-aged adults rather than older adults. And then it gives physical preparation for sport and for life. Learning how to move well and learning how to move and apply force, absorb force, move quickly, decelerate, can all play into sport performance and general health. So it's not just that it's developing them physically for their sport, it's developing them for long-term functionality as human beings. Okay, another one that I really want to talk about is that this physical preparation for sport may need to come in this area, in this sports performance or resistance training, private sector or in the school sector, because youth are not as physically active as they once were. This gives them an opportunity to be more physically active and be physically active in a very controlled and very specific way that is going to develop them for their sport. So they're learning how to move well, they're learning how to apply forces and decelerate, accelerate, where they would learn something like that on the playground or in physical education class. Now they don't have those opportunities. The weight room or some kind of resistance training or physical preparation program can be a way to do that and accelerate that process, or make sure that we're not getting hurt because we're not ready to move well. Okay. There's also risks with resistance training. There's risks with all physical activity, all sport, but under proper supervision and with proper progression from a certified strength and conditioning coach who knows what they're talking about, knows the proper progressions, knows exercise technique, there is very little risk. Okay. These movement patterns are nowhere near the danger that comes in sports, especially contact sports. Okay. There's lower forces applied in the weight room compared to in regular life or in sport. A vertical jump, the landing forces are near 6 times body weight from just a maximal vertical jump. There's no athlete, I don't know any athlete that can squat 6 times their body weight. There's no one really that's doing that, especially at this youth and adolescent age. Okay, so there are much lower forces and they're applied at a much lower rate, but it does develop tissue to be able to absorb those forces. Okay, they're also applied at much slower velocities, and we know that the rate at which force is applied is a huge indicator for injury risk. So forces that are applied slower are less risky and really going to help to develop tissue, connective tissue, muscle tissue, bone tissue, so that those athletes are safe when it comes into sport, when they're being exposed to high velocity, high force experiences within that sport. If we look at some of the statistics, this is taken from USA Weightlifting. Weight training itself has an injury rate under 0.003 injuries per 100 participant hours. Okay, if we look at powerlifting, which some say is, oh, maybe that's more scary because they're lifting towards maximal, even lower injury risks. And weightlifting, Olympic style weightlifting, even lower risks. Okay, if we look at all of these compared to something like track and field, a much higher risk. Basketball, higher risk. Cross country, higher risk. Something that you would think would be a lower risk, high risk. Basketball, even higher risk. If we look at rugby, soccer, rugby, all of these have, even tennis has a higher risk of sustaining an injury than weightlifting, powerlifting, or weight training in general. So this is not where the risks are. The risks are really in the sport. The resistance training develops the capabilities to handle those forces and be better prepared for those risks. So if we go through the guidelines, the NSCA has their guidelines, okay, that there are benefits with resistance training programs as long as they are age specific and follow training guidelines. Okay, if we follow our principles of strength and conditioning, follow our progressions, teach movement and skill first, and then begin to apply more stimulus, more volume, more intensity when they are competent, there is no real inherent risk or maximal risk that most see with resistance training. This is a nice little figure from the NSCA about each of their kind of small incremental recommendations when it comes to resistance training for youth or adolescents. Increasing resistance gradually, small increments of additions, performing 1 to 3 sets of 3 to 6 repetitions, 1 to 3 sets of 6 to 15 repetitions, and we continue to move forward and forward and forward, cool downs, being sensible progressions. These all are integral to our training programs for our adults, for our general population, for our athletes, and they're also the same for our youth athletes. The loads that they're going to experience are much lower. It's our job as the professional to not let them go beyond what they're capable of and help them to understand that progression is necessary and understand that this will benefit them, but they can't get to the top from the first step. Okay, so helping them to progress is our job. So what are some considerations when you're coaching, when you're working with these athletes? Kids aren't mini adults. Okay, they're at different developmental stages, both physically and cognitively. You can't treat them like miniature adults, and you need to help guide them and help teach them and make it fun. Okay, females and males are more similar than different until puberty. So if you're working with that elementary age group, they're probably pretty similar physically, cognitively. And you need to understand that there isn't really a discrepancy yet. Females will develop sooner than males. Hypertrophy will also be minimal in females compared to males, especially during youth and adolescence. And you should express that to them. They should understand that this is what's going to happen. A lot of times, or more frequently, there were kind of apprehension for females training because they thought they were going to build hypertrophy. If you look at the male athletes that are trying to build hypertrophy, they still don't, not to the extent. So that fear it's not really going to happen hormonally, physiologically, it can't happen to the same extent as with males. And it takes quite a bit of training to get to that hypertrophy point that may be detrimental for the athlete. So make sure you understand that, they understand that, and that it's there to develop them. It's not there to change their appearance unless that's really their goal. And then make it fun. It should be fun. The more fun and enjoyable training is, the more likely your athletes are going to come back and come back and come back for the rest of their life, and which is what we really want. We don't want them just to be good on the field during their senior year. We want them to continue to train and live a healthy, physically active lifestyle long-term and be functional, contributing members of society. Okay, this is where proper technique comes in. Learning proper technique first and building from that proper technique is crucial, because with a foundation of technical knowledge and understanding the movement pattern, you're able to build progressions with intensity, with volume in a safe manner. If we kind of leave technique to the side and just load more intensity, more volume, that's when we see those risks of injury in our weight room. Okay, and then focus on the progress. We want to see change, and change is our goal, especially with these youth athletes, okay, or these just youth in general. Understanding that the road and the journey is where the fun is. It's not the destination. It's not the final product. It's not the absolute load they lifted that day. It's the fact that they lifted a little bit more or a few more repetitions than the time before. That progress is occurring. The more you can show progress and the more you can instill that progress is the goal and progress is fun, they're more likely to continue to come back. And when it's time for adulthood and when they're fully developed and they can really apply those maximal loads, they can really get those high level adaptations that they need for high level sports performance. Okay, now let's shift gears a little bit and look at older adults. Okay, one thing that is great about kind of this continuing aging of our population is that more older adults are physically active and more older adults are changing or are training and helping develop themselves. You can follow Masters track and field. They have the over 100 years old age group. There's Masters CrossFit, there's Masters powerlifting, there's Masters all sorts of sports. So people can continue to train and continue to compete even further in their life career. Okay, some things that we do need to pay attention to, though. There are changes with age. We know that, and we know there's some major negative changes when it comes to age. One I already talked about is osteopenia, sarcopenia, or osteopenia and osteoporosis. Sarcopenia is also the loss of muscle mass and fat infiltration into muscle mass. Sarcopenic obesity are things that we really need to pay attention to because it's happening to our older adults and it's happening to our middle-aged adults also, especially if they're more sedentary, less physically active, eating a less nutritious diet. Right? Resistance training itself can oppose most of those negative changes from aging by improving quality of muscle fiber size. We've seen that muscle fiber size has even increased, and bone mineral density has increased in individuals over the age of 70. Okay? It just improves overall physical function. Okay? Think about long-term physical function. If you can stay out of assisted living for longer, you're probably going to have a more fulfilling life. Okay? Because most of those goals around resistance training for older adults should be around activities of daily living. Walking well, okay? Going upstairs, gait, think about things like lunges or carrying objects. Okay? Stair ascent, think about lunging, squatting, or using your knee and hip extensors. Okay? Balance exercises, unilateral exercises, and other kind of reactive activities, things like agility training in a maybe more regressed sense, can benefit reactive components in older adults. And reaction is key to preventing falls. Okay? We know that falls can lead to some very negative consequences very soon after the fall, especially the older the adult gets. So training balance, training reaction, it doesn't have to be heavy resistance training. It can be fun, it can be agile, it can be walking, going up and down stairs. Make it fun, make it applicable to their life or their sport in a sense. So now you think of life and function as the sports. Use your needs analysis process around activities of daily living to prepare them for activities of daily living. Okay. There's also some anabolic effects like hypertrophy, improved metabolism, improved bone mineral retention. These are all key components to a healthy aging process and a more functional aging process. So here are the guidelines, the recommendations. Okay. Everyone should be pre-screened. Okay. See a doctor, make sure you have a doctor's clearance. Make sure there's no underlying cardiovascular, metabolic issues, or musculoskeletal issues. You'll often be working with individuals with some kind of problem, pre-existing condition. Make sure you know what it is and make sure you program around that accordingly. Make sure there's at least 5 to 10 minutes of warm-up that is going to improve or increase core temperature, maybe improve some range of motion, and get that older adult ready to train in the way that they're going to train. They perform some static stretchings before and after, especially to improve range of motion. The more range of motion we can gain and utilize, the older we are, the more functional we can be. And then use resistance that is taxing, but it's not going to overtax the musculoskeletal system. As you age, you don't recover as quickly as younger adults or as youth or adolescents. Plan accordingly when it comes to your stress and recovery, and allow them to continue to progress in a way that's not going to dip them too far into that negative recovery or overexhaustion zone. But when we're working with these individuals, safety should be our first priority. Think about safety, plan around safety. If you think something's going to be unsafe, make a modification, add a point of contact, add some more stability, change it from standing to seated, change body position, change surface. Give them the ability to feel safe and be safe. Okay, start slow, especially if you're working with someone who maybe hasn't trained in the last 20 years and now their doctor says you need to train or you're not going to live as long. It happens. Start slow, start them somewhere and really build that progression. Okay, find pain-free range of motion, especially if there's pre-existing musculoskeletal issues like osteoarthritis. Find what they can do and use that. Don't really push them to something that is unnecessary or is beyond their capabilities at the moment. Make them feel successful. Okay, they should feel successful. The more successful they feel, the more fun it is going to be for them. Okay, give them that self-efficacy, give them that enjoyment of being successful, and then make sure that they understand and make sure that your exercises transfer to activities of daily living. They maybe point out, hey, this exercise is going to help you going down the stairs. This exercise is going to help you getting in and out of the shower. Okay, these are small things that we think or we take for granted. We think they're easy, maybe very difficult for these older adults. So take those into account, think about them and plan accordingly and coach accordingly. Make it fun, make it enjoyable, make them want to come back to you and try to make every single session they see you the best part of their day or the best part of their week, because then they're going to keep coming back, and then they're going to keep enjoying the process and live a longer, healthier life. All right, that's it for our discussion on older adults and youth and adolescents and how to program, how to train around them. Really make those adaptations and make those changes when you're working with your clients or your athletes or any individual you end up working with. Keep these into account. Take safety first, technique, and progression. All right, thank you very much, and I'll see you next time.